So I've been told I've got neurogenic bladder. Can you tell me what this means?
Yes, a neurogenic bladder or neuropathic bladder is a condition where damage to the brain, spine or nerves can result in interruption to the nerve supply to the bladder and its sphincters. This can result in issues with storage of urine, but also the contraction of the bladder to release the urine. And we find it's quite common in those underlying neurological condition. Patients will commonly come to clinic with issues of bladder overactivity, sometimes associated with incontinence, high frequency of passing urine, up to 8 times a day, and sometimes a night as well, the sensation of incomplete bladder emptying, and occasionally people find recurrent urinary tract infections as a reason they get brought into clinic. By speaking in clinic and running some effective tests, we can often find some management options which will improve people's symptoms long term.
So can you explain this in more detail? How does a nerve injury give bladder symptoms?
Yes, in a normal bladder, which is a muscular ball, it has an internal and external sphincter. As the bladder slowly fills with urine, the sympathetic system helps keep the bladder relaxed and helps constrict the internal sphincter. When the bladder reaches a certain fullness, a stretch receptor sends a signal to the brain, and after some communication, if it's an appropriate time to pass urine, a signal is passed back down through the parasympathetic nerves. This contracts the bladder and relaxes the internal sphincter, allowing the bladder to empty fully. To complicate matters, there is also the external sphincter, which is maintained under conscious control, which is a muscle you can tighten voluntarily when passing urine. It's quite a complicated setup, and injury to any part of it can result in symptoms. Classically, we find there's 3 areas. Injuries to the brain will often result in an overactive bladder. Injuries to the spine may result in an overactive bladder, but sometimes an overactive sphincter as well. Whereas injuries to the nerves can result in an underactive bladder and occasionally an underactive sphincter as well. From a practical point of view in clinic, we try to determine whether the bladder is overactive, underactive, and whether the sphincter is overactive or underactive. An overactive bladder makes people want to go to the toilet more regularly and gives them a severe urge to do so, sometimes associated with leaks. An underactive bladder may give a sensation of fullness and never fully emptying your bladder, and also can leave you prone to water tract infections. An overactive sphincter may give you an interrupted flow of urine or stuttering flow, whereas an underactive sphincter can often lead to stress incontinence, where coughing, sneezing and standing can result in a small amount of urine passing. The biggest concern from our point of view is an overactive bladder and an overactive sphincter, leading to a high pressure in the bladder, and this can cause back pressure to the kidneys and long-term resulting in injury.
So if that happens to me, what happens when I come to see a urologist?
Yeah, so in clinic, patients are often referred by their GP or their regular neurologist if they have an underlying neurological condition and start to develop neurological symptoms. Before you come to clinic, we'll often ask people to collect a 3-day bladder diary where you record your intake of fluids, toilet visits, and any occasional leaks as well. This can be very useful for us to work out the amount of urine your bladder is holding before needing to pass urine, but also what you're taking and whether that can cause irritation to the bladder. When you come to clinic, we'll have a long, careful discussion about your symptoms, review your underlying neurological condition, and establish whether that is static or potentially progressive over the coming years, and look at your regular medications, but also your home life and your day-to-day activities, and what's the priority for yourself on moving forward with management. We'll often perform bedside tests such as a urine dip to see if there's any signs of infection, and offer blood tests to make sure the kidney is stable. We'll often send people away to have an ultrasound of their kidneys and bladder, specifically to see whether the bladder is emptying fully. Sometimes we perform a camera test looking into the bladder called a flexible cystoscopy, but the mainstay of our investigation is having urodynamics or video urodynamics. This is a test where we pass a small tube into the bladder and one to the back passage, and that allows us to monitor the pressures in the bladder while the bladder is filled and when it empties. This allows us to work out whether the bladder is overactive or underactive, and the sphincter is overactive and underactive, helping us establish the underlying problems which we can address.
So once the problem's been identified, what can be done about it?
As urologists, we can't actually address the underlying nerve issue itself, but our priority and our ability is to help modulate your symptoms and make day-to-day life more manageable. From a medical point of view, our priority is to make sure the bladder remains under low pressure. So specifically those with spinal injuries are at risk of having a high overactive bladder and an overactive sphincter, and that can cause back pressure to the kidneys long term, and we need to make sure we address that as a priority. And normally we address issues of incontinence first, and then move on to other bothersome symptoms to make sure day-to-day life is functional. All treatments depend very specifically on your underlying problem, medications, and what the priorities are for individual patients. And we often move down a stepwise progression of management, not all of which apply to everyone who comes to clinic. Often we'll start by trying to move fluid intake to earlier in the day if overnight waking is a bothersome problem. Quite commonly we will recommend cutting out bladder irritants, the main one being caffeine, which can make people again have an overactive bladder. Sometimes we'll recommend a timed voiding schedule, and this is where by emptying the bladder routinely, people aren't bothered by the bladder filling up as much. If these don't work, we commonly refer people across to physiotherapists like yourself. This can help strengthen and control the muscles which work around the bladder to keep people dry. And altogether, these relatively straightforward interventions can actually help a lot of people resolve their symptoms without any further medication. For those that medication does not help their overactivity fully, we can offer Botox injections into the bladder wall itself. It's performed under a local anaesthetic, although occasionally general anaesthetic as well, and it helps relax the bladder for about 6 to 9 months. About 10% of people find the bladder doesn't empty fully after Botox, so we do have to make sure people are able to perform intermittent self-catheterization, and this is where you pass a thin, flexible tube yourself through into the bladder and drain off the excess urine. It quickly becomes a regular part of people's daily routine and is very well tolerated, and actually probably the best management option we have for a lot of our patients with neurogenic bladder. It will prevent them having the symptoms of full bladder, an overactive bladder, and in those with high pressure, help keep you safe long term. And in some, we can offer neurosacral modulation, which is a procedure where we're implanting like a pacemaker for the nerves of the bladder. And in some protracted courses where people have ongoing symptoms for many years, there are a number of reconstructive surgeries which can be carefully considered, but normally after a long consultation period and trying everything else first. Often we will arrange follow-up as well to make sure your symptoms are controlled over the years, sometimes with ultrasounds and blood tests as well to make sure the kidney function remains stable over time.
So do these treatments work? Will I feel better?
In a word, yes. We offer a different variety of management depending very particular to patients, and nearly always improve symptoms quite significantly, and we'll discharge people back to their GP's care with a much improved day-to-day life. You'll be cared for by a number of people, including the urology consultants, nurses, physiotherapists as well, and together we often have a very significant impact on people's lives. If anything I've been discussing does sound familiar and you have an underlying neurological condition, do consider discussing with your GP or neurologist for a referral to a urologist who specialises in neurogenic bladder.
Thank you very much.
Thank you.